Hi everyone. In this clip, I want to talk a bit about ACL or anterior cruciate ligament injury. Please note that anything I record here are for informational use only, and it's not intended to diagnose or cure any ailments. Just to give you an understanding of what ACL is without going too deep, bones in knee area are connected to each other by ligaments. We have 4 primary ligaments in our knees. They act like sort of like strong ropes to hold the bones together and to keep the knee stable. We have a set of these ropes inside the knee joint. They cross each other in a form of an X, with the anterior cruciate ligament or ACL in front and the posterior cruciate ligament or PCL in the back. So these ligaments control the front and back motion of the knee. The ACL runs diagonally in the middle of the knee, and it provides rotational stability to the knee. The PCL keeps the shin bone from moving backwards too far, and it is stronger than ACL. About half of all the injuries to ACL happens along with damage to other structures in the knee as well, like articular cartilage, meniscus, or other ligaments. Injured ligaments are considered sprains, and they have a severity scale grading that they look at. So for example, we have grade 1 sprain. This is when the ligament is mildly damaged, it has been slightly stretched, but is still able to help keep the knee joint stable. Then we have grade 2 sprain. This is when the ligament is stretched to a point where it becomes loose. This is often referred to as partial tear of the ligament. Then we have grade 3 sprain. This is the type of sprain which is most commonly referred to as a complete tear of the ligament. The ligament has been torn in half or sort of pulled directly off the bone, and the knee joint is unstable. So partial tear of the ACL is usually rare. Most are complete or near complete tears. Usually they use MRI to see a better image of the soft tissue to diagnose this, but an MRI is also not needed to make the diagnosis of a torn ACL. There are a variety of alternative non-surgical methods to help heal the ACL injury. Things like stem cell therapy, orthobiologics, as well as plasma therapy. Also progressive physical therapy and rehabilitation that can restore the knee to a condition close to the pre-injury state. And also, I understand that stem cell therapy right now is the leading the way. As per British Journal of Sports Medicine, in athletes going through progressive physical therapy and rehabilitation, patients were asked to wear a brace for about a month that kept their knee at a 90-degree angle, which is the position that keeps the torn ends of the ACL closest to each other, increasing the likelihood that they're going to fuse. Over the next couple of months, patients underwent physical therapy, and their braces were slowly adjusted to increase the range of motion. Then the braces were removed around the 3-month mark, and at this point, they had an MRI, and again they had another MRI at 6 months, which showed that most ACLs repaired themselves. Best supplements for patients during the healing period are things like gelatin and collagen, glucosamine chondroitin, omega-3, B-complex, iron, multivitamin, high-dose vitamin C, and multimineral supplements. Avoid sleeping with the knee in bent position because this can build up the scar tissue, and don't put too much pressure on the knee. Metaphysically speaking, ACL injuries usually happen when there's a conflict where one part of you wants to go and where the rest of you actually sort of doesn't want to. So sort of like your heart is yearning to go somewhere and your feet don't. Try and find out if you are happy in life where you are right now. Are you comfortable and safe in your physical environment? Is there a part of you that wants to move into a new area of your life? Is there something you need to let go of in order to move forward with what you want? What is your relationship with your roots and family right now? And of course, few more of this kind of things that is worth contemplating as you're concentrating on being healed. Like and follow for more. Be the light.